stretching her legs and everything.
Stretch.
Yeah.
It all happened within 5 hours. It was the fastest 5 hours of my life. I hadn't felt her moving around all day, and she was usually very active. So I called the doctor, and he said, just do yourself a favor, go to the hospital, get checked out. It's probably nothing. So it kept progressing throughout the night. So it was, we'll keep you here for an hour, we'll keep you here for 2 hours, we'll keep you here for 4 hours, we're going to keep you overnight, we're going to move you to labor and delivery just in case. And that's kind of when we started to panic a little bit. And a little while later, all the doctors and nurses came in and said they strongly advised us to deliver her that night. I remember asking the doctors, can you even deliver a baby this young? And we were just so horrified at it.
The whole process is kind of like going into hyperdrive, and it's very surreal. You know, you're sort of expecting this baby to come several months down the road, and all of a sudden it's like, well, it's going to happen in an hour.
In most cases, we can't prevent prematurity. If we knew how to do that, we would do it. A baby is considered premature at any time less than 37 weeks. So a normal gestation is considered 40 weeks, around 9 months, and under the 37th week is considered premature birth. Zoe Wells was born prematurely in, I believe, a 28 week gestation. She initially had some respiratory distress syndrome, was on a respirator machine for just a few days. So she's been breathing just atmosphere, room air, ever since, and working on learning to grow up, learning to eat, gain weight, and so forth. So, in our book, she's done very well.
Hi, sweetie. Almost. There you go.
So we've been really lucky. She's done everything really well so far. She hasn't had any problems or complications, or she's just kind of in here growing and getting bigger.
Nationwide in the United States, approximately 10% of all births are considered premature. Yeah, and her muscle tone's really good. She's most of the problems of premature babies are maturation problems. They're not supposed to be out yet, so their digestion, their breathing, and so on just aren't taking hold. And our job is actually help them through those until they get close to their due date. And in most cases, once they're getting up towards their due date, the babies take over most of these functions. Well, there are a whole host of reasons why babies are born prematurely. Multiple gestations, if there's twins, triplets, or quadruplets, there's not as much room in the womb, so babies tend to come out early. Certain maternal conditions require the baby to come out early if the mother's sick with blood pressure problems or kidney failure and such. Sometimes the water bag, the membranes break early. We don't know why that is, but when that happens, there's likely to be premature birth. Premature labor, which we don't understand why, with no other complications, the uterus sometimes simply starts to contract before the 37th week. That's a very common cause. When a premature baby is born, then the expert staff, which are neonatologists and neonatal nurses and respiratory therapists, start to take care of the premature baby right away in the delivery suite. The babies are transferred readily to either a stabilization area or an intensive care unit. Initially, most premature babies are fed intravenously because they're not prepared to digest. Then, assuming mother's going to breastfeed, the mother starts to pump her breast with electric breast pumps. We have whole systems set up to take that milk and label it and freeze it and store it and then give it to the babies as need be. Initially, usually through a tube feeding because a small premature baby can't suck and swallow and breathe simultaneously. So they start with tube feedings. Then around the 33rd, 34th week, most babies learn to transition from the tube feeding to a bottle feeding with a soft nipple and also at the breast. If mother cannot breastfeed or is not going to breastfeed, then we have special formulas that are made to meet the nutritional needs of premature babies. Once a premature baby is discharged home, the follow-up needs vary. Most premature babies still do need special attention, at least in the early weeks and months, watching their blood counts for anemia, which can be low, making sure their weight gain is good. Some premature babies are home on a breathing monitor. It's a risky situation, there's no doubt about it. When a baby's born prematurely, it's definitely a risky situation, and so we can't ignore that fact. Some premature babies, their lungs are underdeveloped or have other complications that we can't deal with, and some of the premature babies don't survive, of course. But for the most part, most premature babies go home and fairly rapidly get into a fairly normal existence.
I woke up on June 18th that morning at about 5 a.m. and normally I usually get up at 5, went to the bathroom and noticed lots of blood. And my gut said, let's call 911. What they did at the hospital once I arrived is examine me and realized that the placenta abrupted. So the baby was not stressed, the baby was fine, he was doing wonderful, but they couldn't stop the bleeding. So they wanted to save me. So they said, we have to deliver by emergency C-section. This is the third child. I have two other children, Sierra and Tyler. And this was the first time I had a premature baby. The other children were full term, no problems at all. He checked out of the hospital on July 28th, so he spent a total of 5 weeks there, and which he came home earlier than the normal due date. Usually prematures stay until their mature date. So he came out early because he was doing very, very well. There's still lots of visits because he's still considered premature. So we've been going every 2 weeks to the eye doctor and pretty much every 2 to 3 weeks to the pediatrician until that first year, and they explained that to me. During the first year, it's kind of critical still because you don't know the development stage. So although he appears to be fine, beautiful, and healthy, they still have to monitor his development stage. What I can recommend to other moms to be is definitely take one day at a time. I mean, everyone wants to have a full-term, uneventful pregnancy, but things like this do happen. I'd say pack that bag early, and having the doctor's information available, that kind of emergency kit. I mean, considering it was an experience I'll never forget, it has blessed my life.
We have babies come back for follow-up visits every day of the year, including we have twins today who are extremely sick in the nursery about 2 years ago, on respirators and low blood pressure and the whole 9 yards. And they come walking in and saying, hi, how are you doing? Thank you very much. And so it's a very gratifying field.